We're starting with those COVID cases that are on the rise in parts of the U.S. Now, thankfully, we told you this week, here in the Carolinas, the numbers are pretty stable. CDC saying that most North and South Carolina counties have low COVID impacts. But we are asking the questions here that everyone is wondering. WCNC Charlotte's Chloe Leschner live in Uptown. You know, Chloe, we're talking about cases here. Are we really getting the full picture by looking at cases?
Hey, Vanessa. Well, demand for testing is way down here in the Carolinas, and with the availability of at-home tests, more people could be testing positive at home, and they don't need to report it to anybody. The days of waiting hours in a line to get a COVID test are long gone. As the number of cases and hospitalizations fall in both North and South Carolina, the number of people getting tested is decreasing too. The latest data out of South Carolina shows over the last week, the testing rate is 18% lower than the average test rate over the last 30 days.
We're still offering testing. I know we're in the process of cutting back on our testing at locations in our major markets.
The wide availability of at-home tests is likely reducing the need for as many testing sites. Families can get up to 8 free tests from the federal government, and health insurance companies will reimburse for 8 purchased at-home tests every month. But those positive test results aren't reported, so state data isn't necessarily the most up-to-date. It's why wastewater surveillance and ER visits are now better indicators of if COVID levels are rising. The latest North Carolina data shows wastewater particles increase slightly, while ER visits and hospital admissions continue to decrease.
We're able to potentially see when cases are going to go up again and perhaps get ahead of them a little bit in terms of, urging people to be more cautious or consider masking more, or let's go back to doing some social distancing.
With both Easter and Passover coming up, testing could play a big role. If you don't feel well, definitely take a test before gathering, but it couldn't hurt just to take one as a precaution. But Dr. Bregier did say for people who are fully vaccinated and will be spending the holiday with other people who are fully vaccinated, it should be relatively safe. Live in Uptown, Chloe Leschner, WCNC Charlotte.
Chloe, thank you so much for that.